afternoon, friends. I am Dr. C.C. Nair, a physician and internal medicine specialist attached to Lilavati Hospital. Today's topic is hypertension, which is a very common disorder. And hypertension, by the word itself, suggests that there is very increased dramatic pressure inside the blood vessels. And that is the root cause for all the problems that we face because of tremendous pressure inside the blood vessels and therefore related problems regarding the organ damage and also the results of many ailments like cardiac ailments, renal ailments, and even brain ailments, along with ophthalmic problems. What is the cause of hypertension? Hypertension by itself, if you notice, is a result of increased anxiety, increased stress, as the word suggests. And not only that, it is also important to realize that our eating habits, our habits that we form, by which we find that body weight increases, we have lack of exercise, or sometimes hereditary factors. Now, hereditary factors are the only factors which we cannot decide upon ourselves or help ourselves, but at least the other factors which are modifiable should be helping us in controlling this oft seen bad ailment, which has got tremendous fallout on our health status. And we find that there are increasing number of people who are suffering from hypertension because of the stress levels increasing these days. People have been indulging in lot of salt intake, people have been indulging in alcohol, people have been indulging in smoking. Exercise plays a big role because not only it reduces the stress hormones are released to a lesser extent by way of exercise, they are controlled, and you have endorphins coming up, which has got a good effect on the system. And we also see that exercise improves the lipid structures, it improves the chemicals in the blood. All the hormones are regulated because of exercise. And it's important to realize that once in a year, you should have a complete health checkup to detect all these unseen things which you can't make out in our day-to-day life by going to a doctor and checking up yourself. And once you find that this blood pressure is there on 2 or 3 readings constantly, then these are the people who probably has to modify themselves. First advice would be to change their life habits. Second advice would be taking the medications as per the doctor's prescription regularly. And the third, of course, is the diet. Most important is the diet, because in our country, tropical areas, we find people in Southeast Asian nations indulge in a lot of salt intake as a routine in our diet. It's very important to see that all the salt that we take many a times directly affects the blood pressure of the person. And therefore, from time to time, we have to take the cautious note of substances which contain salt, like for example, pickles or papads, or maybe even bread slices, which also contains a lot of salt, apart from the salt that we put in our routine stuff like dal or eatables that you normally eat. And second most important thing is also the oily stuff, which tends to increase your weight. So the fat in the diet itself can increase your weight, which ultimately adds to the burden of hypertension. So it's important that we regulate our weight from time to time with diet control, also with a lot of exercise. And it's to be noted that all these things can only follow with high motivation. So it's important we, by our talk, our way of communications, should be able to initiate the motivation in most of these patients by telling them that they have to follow these principles of trying to reduce your weight, trying to reduce your salt intake by way of diet, and also try to curb your tendency to have alcohol or excess alcohol or smoking or tobacco in any form. And therefore, I think we come to the topic then, how do you diagnose blood pressure? When do you start feeling that the BP is high? That again depends on age also to some extent. But by and large, we feel by international standards, any systolic pressure, the upper reading of the pressure, if it goes beyond 130, and the lower reading of the pressure, if it goes beyond 90, they are to be considered as a subset of hypertensives. And this can vary and go on from person to person, right from beyond 130 to 140 to 150 to 160. And similarly, the down diastolic reading can go from 90 to 100 to beyond 100. But what is more important is there is a thing called hypertension leading to brain damage. Now that level probably will be approximately 180 of systolic and 110 of diastolic. If you come to that level, then you have to be extremely cautious and see that you adjust your drugs accordingly apart from the lifestyles, and see that everything is controlled properly by way of medications and instructions that are given to you. So if you have BP one reading, you should always try to see that you have a second reading and a third reading, and if it constantly remains on the higher side, then of course that is an indication for appropriate medications. By way of medications, we have excellent drugs these days which help us in controlling the blood pressure. We have vasodilators, we have anti-hormone drugs which control the hormone effects. Suppose a patient is a cardiac patient already, or is a renal involved patient, or if he had a stroke before, all these things would help us decide which drug will help him the best. And that is for the physician to decide and tell the patient that, look, these are the drugs that has to be taken by you regularly, and see that the BP is also checked up, following up with regularity. And we have seen cases where people have really done well after controlling the pressure properly. Once again, a word of caution that no blood pressure should be brought down very rapidly. So it's important that we assess the BP of the patient and also gradually reduce the blood pressure. If you reduce the blood pressure suddenly, a sudden fall in blood pressure also can damage, and therefore the drugs have to be adjusted in such a way that you have a general gradual fall in the blood pressure. I think with this, probably if you follow these instructions, apart from the hereditary factors, regular checkups of the target organs of blood pressure is important. Now, what would be the target organs? As I said, kidney would be one of the prime organs. You have to check the kidney levels from time to time. That means the creatinine levels, or maybe a urine routine checkup, or sometimes urinary albumin levels. And there is something called urinary protein levels also. If you check up this, you find whether the kidney is in order or not. Similarly, cardiac checkups are also important. Apart from a routine ECG, one would also advise, if the ECG is normal, these patients can be subjected to a simple stress test to find out if the heart is okay or not. Along with that, you can have a 2D echocardiography to tell you whether the heart muscles are functioning well or not. Is there any effect on the muscles, especially the left ventricle? We call that left ventricular hypertrophy. And most important, apart from these two, is a general checkup of the eyes, because once the eyes are a level, or suppose an indicator of what is happening inside the body. So you can test the blood vessels inside the eye, like retinal blood vessels. If you have any hemorrhages, or if you have any sort of edema around, that is an indication that the blood pressure has not been controlled well, and probably it is leading to some changes in the eyes also. And that would probably warn us that we should tend to agree on controlling the blood pressure more rigidly by enhancing the medications, by strictly adhering to the lifestyles as I mentioned, and all these factors help in contributing to improve our general stuff. So therefore, let us all now unite together to see that this hypertension, which is a big silent killer, is silenced forever, with each other cooperating, and I think we look forward to a healthy life. Thank you.